So labiaplasty is the medical term for removing the excess tissue of the labia minora, or what lay people call the inner lips.
Well, labiaplasty in the last several years has really had a surge in popularity. And I think it's due to several factors. I think that women have probably always been self-conscious about it, especially the women that are having functional problems, which I think is the vast majority of patients. They have discomfort when they ride a bike, when they ride a horse, when they run. Sometimes they can rub together. And I think, the internet, now that they can research these things, like from the privacy of their own home. And then I also think that grooming habits have definitely increased the incidence of this, because women are now shaving everything, Brazilian, etc.
People are just less willing to live with things that bother them.
And I think a misconception is that men are really pushing this, and they're really not. I mean, I feel like when I ask my patients, like, what's driving you? Like, why now? Why are you here now? And it's almost always like for them, like they don't like the way it looks. They don't like the way it feels.
Part of it can be to rejuvenate the labia majora, which is the outer portion around the labia minora. And this can also lose volume and age. And oftentimes we will find that a patient not only needs the labia minora reduced, but maybe have a little fat grafting or filling of the labia majora, because that area should be fuller, and that's a more youthful appearance. And in modern times, the clothing, swimsuits, etc., can be revealing of that area if there is a problem there, and they just want to feel comfortable in their clothing, feel good in a bathing suit, and not feel like everyone is seeing that area. 100 years ago, you don't know what your friend's vagina looks like because she's wearing a dress down to the floor and a bonnet. And so, it would be taboo to discuss it, so you don't know. For the most part, the vulva should look a certain way within standard deviation, and if you fall outside of that, you recognize that now and you want that treated.
It's really a functional thing. I mean, they definitely don't like the way that it looks, but I think a lot of times it's bothersome. I feel like I can't do the triathlon, and it's Austin, and we have lots of...
You can't run, you can't ride a bicycle. You'd be amazed at how many people do it because they can't ride the horse. It can cause sexual dysfunction and make that uncomfortable. It's too much tissue where it doesn't belong. And they just want that treated.
When we first started performing this operation, I thought, wow, this is really going to be uncomfortable. How are they going to sit for extended periods of time? And most of them really say, I mean, it's mild discomfort. I think as the sutures are dissolving, which they all dissolve on their own, they'll have some itching kind of in that area as those sutures are dissolving for a week or so. But most people say it was a whole lot better than they thought.